Hey guys, let's get started with our first lesson for Module 1. So this lesson is all about temperature. So keeping things at a normal balance in the body is really important. There's billions of reactions taking place all over your body, from the oxyhemoglobin curve to cellular metabolism, DNA replicating, blood clotting, nutrient absorption, and all these reactions only take place if the body's at the right conditions. So these conditions are called homeostasis. So think about things like pH, electrolyte levels, fluid levels, and temperature. Some examples of the different parameters that we need. So when we're thinking about temperature, we're going to measure temperature in Celsius here in Canada. But general public will sometimes go the American route and use Fahrenheit. Alright, so lots of stuff going on in the body, and everything needs to be at the right temperature to work. But what is that normal temperature, or what is that temperature? So a normal body temperature is 36 to 37.5 degrees Celsius. That's going to change based on a whole bunch of factors, things like time of day, ambient temperature, exercise or activity level, stress, medications, digestion, or even illness. So our body isn't super strict on this. We've got a little bit of buffer room. We'll still function as low as 34 and as high as 40 degrees Celsius without any real problems. But once you start getting outside that, a lot of these functions that we talked about before, they start to stop or even fall apart, and that's when we start to get really sick. So when we're talking about temperature, it's important to know where and how we're measuring it. So core body temperature is the internal body temperature, and this is really different from the temperature in your peripheries. It's a really easy test. Just take your hand, put it in ice water, and then go grab a thermometer. Your core body temperature obviously isn't that low. So when we talk about core body temperature, which should be around 36 to 37 degrees Celsius, it's actually really tricky to measure. The best way is with something called a pulmonary artery balloon catheter. It's this really long catheter which is floated into your vena cava. It goes into your right heart and is placed in the pulmonary artery. Among other things, this can give us a really accurate reading of the body temperature. That's a pretty invasive procedure though, so it's not something we're going to be doing in a clinic or in the back of an ambulance. So the next most reliable way of measuring temperature is rectally. Works really good for kids who won't tolerate oral thermometers or for your unresponsive patients. Conscious patients aren't going to like this so much. Bladder and esophageal temperature probes are also similarly as accurate as rectal temps, but they're pretty invasive, so you're not going to see those very often. So what does that leave us with? Well, there's some other ways we can record temperature: orally, axillary, tympanically, and temporally. And these are fine, they're quick, they're cheap, it's not invasive, it doesn't take a lot of equipment. The problem is that they're really not accurate, and a lot of things can skew your results, things like ambient temperature, movement, and patient conditions like shock.